Okay, my name is Voith. I am physical therapist, also a manual therapist, and since now, I think 15 years, also teacher in the CRAFTA organization. And we are now making since half a year also courses here in Israel, in Tel Aviv. And when you look now at the CRAFTA, I think CRAFTA is the organization which is worldwide the most fundamental one in the cranio-mandibular field. And we have in the basic course 2 parts. This means the first part is 4 days. And there we talk about cranio-mandibular field, also to the connected fields in craniofacial, craniocervical, and also in nerves. And then we also look at the craniocervical part and the additional things like other structures, hyoid bone, upper thoracic spine. And during the first 4 days, we talk only about cranio-mandibular, connection to other fields. And then at the end, we also talk about the general techniques on the neurocranium. This means we also examine and treat then the cranium. This is the first 4 days. Then the participants have also an additional e-learning course. This means they have their account for 3 years. And then they can also look once more at all the fields we did as repetition, also for additional stuff. And the second 4 days are done in that way that we say we do also fields of the cranial part. We do specific techniques on the neurocranium. This means we assess and also treat each parts of the cranium. Then afterwards also the visceral cranium. And then the last 3 days on the course we talk about cranial nerves. We're doing all the 12 cranial nerves in testing the conduction, testing the neurodynamic tests, and then also palpation. This is the basic equipment you get in the CRAFTA basic course.
Okay, what example pathologies or situations the tools that you acquire in the CRAFTA course are relevant for?
I think in the cranio-mandibular field, we talk about cranio-mandibular patients like disc pathologies, muscle problems, bruxismus, like also other fields like clenching and so on. And what you see in the first part, that there is a lot of connection between the cranio-mandibular field and also to problems like headache, migraine-like headaches, all other types of headache. Then it could also connect to balance disturbances, also to upper cervical spine problems. Then in the cranial field, we talk about all things of headache. Then also the cranial field is more the mechanical interface for the nerves. This means all pathologies on the nerves, and then it doesn't matter if you have cranio-mandibular problems, if you have toothache, in that kind that the dentist don't find anything, or facial nerve palsy. Then also problems with the muscles of the shoulder neck area, like sternocleidomastoid or trapezius muscle, because they can also be treated in that field. Then also problems with the tongue, speeching problems, swallowing problems, and a lot of things can be done in that field also. And then in the end of the course we also talk about the oculomotor system, and this means all things with the eye. This means the connection eye, then balance disorders and also upper cervical spine problems could go together. And at the end of the course it should be that you have really a nice equipment to assess and treat patients in the whole field, which is located up here.
Mm-hmm. If you need to try and characterize the CRAFTA approach compared with other approaches of treating the craniofacial area, Are there any unique characteristics, any aspects that you feel are special in the way the CRAFTA does the assessment and the treatment?
I think the most important thing is that the CRAFTA is working evidence-based. We are looking for studies which are done in the dentist field, also orthodontist field, plastic surgeons and so on. And therefore we have that approach that we say, okay, it's more located evidence-based. And then we do it in a kind of evidence-based practice. This means we do at first the clinical reasoning. Clinical reasoning means you look at the patient in that way that you listen at first at the history, then you do an assessment, and then you find special findings. The next thing you have to do is that you look if the findings are relevant or not, and then you treat the patients in that assess we did already, or we talked already about, and afterwards you can look after the treatment in a reassessment if you're right or not. And this is the typical way of evidence-based practice, how we're working on and connecting this to the evidence-based field with studies which are done till now.